Hello everyone. This video is intended to expand the knowledge of Meben Manor Nursing home staff members about the importance of electronic health records and why it will be a great idea for them to use electronic health records while working on their day-to-day tasks. The first point that we're going to cover in this meeting is the description or a little introduction about the electronic health records, what they are, how they are used, their functions, and other points. So by starting with the definition, an electronic health record is an electronic form of a patient's health information which is created by each patient's encounter in a healthcare setting. So this electronic health record is created after each encounter a patient has in a healthcare setting, and it includes the patient's personal information and clinical data such as progress notes, prescribed medications, past medical history, laboratory data, radiology reports, among others. It can be it can be accessed by multiple authorized users. This definition was given by the Institute of Electrical and Electronics Engineers. The next point that we're going to cover are the different functions of electronic health records. So electronic health records have different functions, and some of them are health information and data. This function involves restoring and providing access to patients' health information to care providers in order for them to be able to take adequate care decisions for better patients' outcomes. The next function is efficient interaction. This function involves saving time of care providers by keeping things concise as care providers are able to easily access the patient's health information. The next function of electronic health records is for the patient support. So this function involves empowering patients to be involved in their healthcare through enabling them to access their health information. The next function is administrative tools. This involves improving efficiency of clinical practices and timely service to patients through scheduling systems and other different administrative tools that allow the empowerment of patients to be involved in their health care through enabling them to participate in the decision-making process. The next function of electronic health records is clinical decision support. This function involves the use of features that help in improving clinical and preventive practices so as to minimize the risk of adverse events or other events that were not planned that might be harmful to the patients. So electronic health records allow different practices and healthcare providers to make different clinical decisions that will be used to prevent adverse events such as injuries and other accidents. And the next function is replicate the workflow. So the function of electronic health records is to replicate the workflow in a healthcare setting. So this is done by using the authentic workflow of the care facility. Due to the fact that the electronic health records involve the use of different applications, it should ensure that the workflow or the authentic workflow of a healthcare setting is used, though different applications are also used. The next function is messaging and processing capability. This involves enabling the processing and exchange of data for interoperability of healthcare applications. The next point that we're going to cover is the importance of electronic health records. So the use of electronic health records play a great role in the improvement of healthcare services provided to patients in the following ways. According to the Institute of Electrical and Electronics Engineers, The electronic health records, they reduce the amount of paper records to store, manage, and retrieve. And this provides more working space due to the fact that the paperwork and other archives that are manual are reduced due to the fact that they are stored electronically in computers. So it offers more working space for healthcare providers. The next importance is that electronic health records establish and maintains effective clinical workflows. And the next one is that they allow easier access to clinical data due to the fact that they're stored in a computer and one worker or healthcare provider is able to access the health information of a patient easily. The next importance is that they improve patient safety by minimizing medical errors and stronger support for clinical decision making. So the electronic healthcare records allow patients to be strongly involved in their clinical decision making as they are able to access data related to their health. The next importance of electronic health records is that they reduce healthcare delivery costs as health information data can be easily accessed by authorized care facilities or care providers. So instead of paying in order to be able to access the information about patients, one is able to access different information about a patient by only using a computer as the data is saved and can be easily shared among authorized healthcare providers. The next point that we're going to cover are the factors affecting the implementation of the electronic health records. The implementation of the electronic health record system in healthcare facilities requires taking into consideration different factors as it involves shifting from the traditional method of recording patient health information using paper charts to electronically documenting their patient's health information in a computer. The following are some of the factors that affect the implementation of electronic health records. The first factor is about the ethical and legal issues. The electronic health record system should address ethical and legal issues that are related to data privacy and security of patients and also the data accuracy before being implemented. And another factor that should be considered in the implementation of electronic health records is the consistent use of standards, due to the fact that electronic health records system requires a consistent use of standards such as clinical vocabulary so as to ensure exchange of data using different health care applications. The next factor that should be taken into consideration before implementing the electronic health records is privacy and security. This is because the electronic health record system must be able to address privacy and security issues as the data of patients should be kept confidential, and this system requires health providers to be computer literate so as to ensure that this is done, so as to ensure the security of patients through using different applications. The next factor that should be taken into consideration before implementing the electronic health record system is the unique identification of patients. The electronic health system should link all data of patients to create his or her single electronic health record, and they shouldn't be a duplicate of patients' electronic health records, due to the fact that this mistake is done because patients go to different healthcare settings, to different hospitals, and this might create duplicates of electronic health records of patients. So there should be a unique identification of a patient. The next point that we're going to talk about are the components of electronic health records. Electronic health records have different components that directly impact different clinical and administrative processes of a healthcare facility. Those components are admission, transfer and discharge system, the clinical system, the laboratory system, the radiology system, and the billing system. So, in this meeting, we're going to talk about the description of two components of electronic health records that is linked to the clinical care. The first component that is linked to clinical care is clinical system. The clinical system of electronic health records involves the electronic documentation, which is used for recording the health information of patients, such as medical history notes, consultation notes, and other vital signs. And this facilitates the medication administration record of patients in the computer system. The next component that is linked to the clinical care is the pharmacy system. And the pharmacy system involves maintaining a drug formulary, filling prescriptions, and cross-checking any orders that are placed by caregivers in the electronic health records of a patient. In other words, the pharmacy system makes it easier for patients to obtain the drugs that have been prescribed to them by caregivers through having access to their electronic health records. Another addition about the clinical system is that the clinical system enables care providers or health care professionals to enter orders that are needed for patient management, such as medical diagnosis, directly in the computer. And we're going to talk about the benefits and issues that are associated to the clinical and pharmacy system. Talking about the clinical system, its benefits is that it enables patients to not lose their medical prescriptions as they're electronic. They are kept or stored in the computer. Another benefit of the clinical system is that it allows the collection of critical patient information, such as vital signs, and this helps to come up with an adequate medical treatment for the patient. But the issues associated to the clinical system is that it is challenging for care providers to shift from traditional recording of patients' health information, which involved using paper charts, to using electronic health records, which requires skills that are associated to technology. The next issue associated to the clinical system is that the use of electronic health records in clinical care might be inefficient due to network stalls or power outages. Moving to the next component, which is pharmacy system. Its benefits is that the pharmacy system makes it easier to maintain a drug formulary, and it also validates any orders that are placed by care providers in the patient's electronic health records. And some of the issues associated to the pharmacy system is that the use of electronic health records in the pharmacy system might be inefficient due to the network stalls or power outages. The next issue is that using electronic health records in the pharmacy system might be difficult and time-consuming for care providers due to the lack of computer literacy skills. The next point, we're going to talk about two components of electronic health records supporting administrative processes. Those components are admission, transfer, and discharge system, and also the billing system. And talking about the admission, transfer, and discharge system, which is also called ADT system, is that this ADT system is a foundation for other health-related information of patients, as it consists of basic information of patients, such as medical record number, age, name, and contact information of patients. And this information can be shared with other health care facilities. According to a website about health, the billing system captures all charges generated in process of taking care of patients, and these charges generate claims that are submitted to insurance companies. This means that the billing system helps healthcare facilities administration teams to easily track the amount of money that patients are required to pay by considering the types of care they have been provided using the computer. The benefits we're going to talk about the benefits and issues associated to the ADT and billing system. First, we're going to talk about the ADT system, and its benefits is that it manages patient registration by electronically recording key patient information such as demographics, insurance information, among many others. Another importance or benefit is that it improves different administrative processes and workflow efficiency in different departments of a healthcare facility. And these benefits were retrieved from the Institute of Electrical and Electronics Engineers. Some of the issues associated to the ADT system is that ADT data is dependent on users to update patient locations. So there is a high risk that if the data of patients is not updated, the healthcare providers will be using the information that is not updated and might not be matching with the current state of the patient. Another issue is that the use of ADT system might be inefficient due to network stalls and power outages, and the use of ADT system might be unfamiliar to healthcare providers, and this might take more time for healthcare providers to use it effectively rather than using the manual data entry of patients. Talking about the billing system, its benefits is that it keeps track of patients, co-pays, and other payments, and it helps to maintain a record of patients' insurance coverage history, and this is useful when seeking reimbursement. It also improves charge capture by using more complete documentation. Some of the issues associated to the billing system is that the use of electronic health records in the billing system might be inefficient due to limited internet connection or power outages, and also using electronic health records in the billing system might be difficult and time-consuming for care providers due to the lack of computer skills. And the last point that we're going to cover is the importance of integration of administrative and clinical areas for effective use of an electronic health record. According to different experts in the use of electronic health records, in the use of electronic health records in clinical areas can help to provide higher quality and safer care to patients through providing accurate, up-to-date, and complete information about patients at the point of care. Additionally, introducing electronic health records in clinical areas can help care providers to more effectively diagnose patients, reduce medical errors, and provide safer care. The importance of integrating administrative areas for effective use of electronic health record system is that it can reduce costs through decreased paperwork and result to improved efficiency and achievement of the business goals. And also the use of electronic health records in the administrative area can help to securely share electronic information with patients and other clinicians that are authorized. Thank you for your time.